Do you know that only 25% of people suffering from pancreatic cancer can live more than 1 year after being diagnosed? Pancreatic cancer is one of the deadliest cancer in the world. That's why it's very important for us to know more about pancreatic cancer. I'm Ira. I'm here with Dr. Lee. He's the medical director of Lee Surgery and Endoscopy. Dr. Lee is a very experienced surgeon in hepatobiliary surgery, and he has a practice in Gleneagles Hospital and also at Farrer Park Hospital. Dr. Lee, maybe you can share with us a little bit more about yourself and what does hepatobiliary surgeon do?
Okay, to begin, I graduated from the Royal College of Surgeons in Ireland for my basic medical degree, and then I did my training in Singapore, from house officer to medical officer to general surgical trainee. I went through the basic surgical training about 2 years, and then subsequently advanced surgical training for another 4 years, and then subsequently went through subspecialty training in hepatobiliary and pancreatic surgery. My interest is in laparoscopic or keyhole surgery for liver and pancreas, and also gallbladder as well. So it is a more challenging subspecialty, but it interests me because it requires a lot of high technical skills.
Okay, what does a hepatobiliary surgeon do?
Okay, firstly, as its name suggests, we see a lot of patients with medical or surgical conditions from pancreas, liver, gallbladder or bile duct. Firstly, we diagnose the condition and then we discuss with patients on treatment options, be it benign condition or cancer conditions as well.
Okay, Dr. Lee, from your experience, right, what are the symptoms of pancreatic cancer do you see in your patients?
Okay, pancreatic cancer is actually a very silent cancer. Like most hepatobiliary cancer, liver cancer, pancreatic cancers, they are actually very silent cancers. Why? Because when patients present with symptoms, they are usually considered at once in their staging. So the most common presentation will be patients having very vague abdominal discomfort, bloating, indigestion feeling, sometimes pain in the upper abdomen that may radiate to the back. And of course, in this kind of patients, the other things that we look out for in terms of history will be whether patients has weight loss and appetite loss. It is a cancer that is more common in the age group of 50 and above.
Okay, so but the symptoms that you are mentioning is very common, right?
Yes, it is actually a very vague symptom. A lot of patients may have this and they may feel that, oh, this is actually a gastric discomfort or stomach discomfort or some indigestion after taking a wrong something that they feel is dirty or not clean, right? So what happens is, how do we determine whether the patients may need more urgent investigations to help diagnosis is when they have things like jaundice, their eye turns yellow, dark colored urine, or when the patient has weight loss and appetite loss.
Okay. Yeah. Is there a risk factor that for a patient to develop pancreatic cancer?
There are some risk factors that has been proven that increases the risk of pancreatic cancer. First of all is smoking. Okay. Secondly, alcohol intake. Alcohol intake may lead to what we call long-term inflammation of the pancreas, which is chronic pancreatitis, and that is actually a risk of pancreatic cancer. Obesity is one of them. The others will be patients with certain genetic conditions. They predispose to higher risk of pancreatic cancer.
So is there any test that you can do to determine this the problems in the pancreas usually?
Okay, so when we first see a patient, usually we will take a very thorough history. We will inquire more about the discomfort the patient has, the past medical history, and also any possible risk factor like smoking, drinking, and we also will try to inquire more about their family history. And subsequently, we'll do a thorough examination of the abdomen, and then from then we will decide what investigation to be performed for the patient. Simple investigations such as blood tests can give us a clue of what further imaging, i.e. ultrasound, CT scan or MRI, to be ordered for the patient. In general, to diagnose, the early test to diagnose pancreatic cancer will most likely be an imaging test. And most often we will perform CT or MRI. Because the pancreas is actually an organ in what we call the retroperitoneal space, and that means that it is behind most other organs. It's just in front of the spine, and the fact that it is an organ quite behind and in front of spine means that there is a lot of gut or
covering the organ.
gut or stomach in front of the pancreas, and because gut and stomach is full of gas, so ultrasound is not the best test to look for pancreatic issue.
I see.
So we will do most like a CT or MRI to check for the pancreas.
Does blood tests can tell you whether you have suspected to have pancreatic cancer?
That's a very good question, because blood tests may give us a clue on whether the patient has got issues with pancreas or liver. Example, if there is a tumor in a certain part of pancreas, we call it head of pancreas, that is pressing the bile duct, patients may have jaundice, and that may cause raised liver function test because the bile flow is affected. But sometimes pancreatic tumor in other places like the body or tail of pancreas may not show any abnormality in the liver function test. And then next question will be, a lot of patients ask me whether tumor markers will be able to diagnose pancreatic cancer. We don't diagnose cancer with tumor markers. In fact, we usually order for tumor markers if we see the patient and we diagnose patient with pancreatic cancer already, yes. And we use that as a way to follow up patient after their treatment. Means if I perform a surgery and our patient goes for chemotherapy, and initially when the patient was diagnosed with pancreatic cancer, tumor markers were raised, and then it became normalized, and then we'll just follow up the patient after treatment with
to see whether the treatment works or not,
and whether the disease comes back.
But if the tumor marker is shooting high, can it be like, oh, okay, this is very significant markers to say whether it's patient have problems?
So I mean, at this day and age, a lot of health screening program or health screening packages, they do include tumor markers. If we see a patient with high tumor marker, we are actually obliged to check on the patient according to which tumor markers that is raised, because at the end of the day, we do not wish to miss anything when the patients have high tumor markers. But having said that, we try to reassure patients, because a lot of times when we see raised tumor markers, they are actually due to other conditions or other non-cancerous conditions like inflammation or infection.
I'm just curious, because when our glucose is very high, it might be due to the pancreas is not working well, right?
Yes.
So does that like a sign that something wrong with the pancreas? Like if our HbA1c is not normal, could that be a sign of?
It's more okay for patients with raised HbA1c or the glucose control is not well, which means patient has diabetes. Yes, and it is more of a functional pancreatic issue. And to be honest, we have picked up. I would say yes and no, because patients with diabetes doesn't mean the patient has pancreatic cancer, but we do pick up some cases of newly diagnosed diabetes in patients more than 50 years old and with weight loss. That patient has new pancreatic cancer. So we do see some patients with newly diagnosed diabetes with pancreatic cancer.
But it doesn't mean that if you have diabetes.
No, it doesn't mean that. But if the patient with diabetes has weight loss, newly diagnosed diabetes has weight loss, and he has poor appetite, then I think it is worthwhile doing a scan to check for any pancreatic mass or tumor.
So the scan that you require to diagnose is the CT scan?
Usually
or
it's CT
MRI?
or MRI.
Yeah, and that too is the most
Yes,
accurate.
the best imaging for pancreas.
Okay, but during health screening, usually we will not be able to.
Yes,
There's no
health screening.
package
Yes, most
CT
health screening will
or MRI.
usually provide at most ultrasound.
But
Because
it can't be shown in
No,
the ultrasound.
ultrasound may only pick up a small part of the pancreas, but not the full pancreas. Yeah, it is not the best to visualize pancreas.
Okay, so for if patient is diagnosed with pancreatic cancer, what are the treatment options available?
Okay, so for patients with pancreatic cancer, firstly, when we see a patient with a mass in pancreas, we will look at the feature of the mass. If it is very suggestive of pancreatic cancer and it is of certain size, then we may not even need a biopsy. However, if of course most patients will be concerned, we may take additional tests like endoscopic ultrasound or a biopsy, imaging guided biopsy to prove cancer before treatment. Treatment depends on how extensive is the disease. So when we look at pancreatic cancer, we ask ourselves, is this a clear-cut resectable, means operable tumor, firstly? Number two, whether it's a borderline resectable tumor. What do we mean by borderline is if the particular tumor is touching on certain main vessels, blood vessels around the pancreas. And the last one, whether this is inoperable. Inoperable means usually the tumor has spread elsewhere. Yeah. So if it is a truly operable tumor, then surgery will be, of course, the best option. If it's a borderline operable tumor, most of the time we will refer the patient to a medical oncologist first to try to shrink the tumor, so that when there is response to the treatment provided, the tumor can be removed with a clear and clean margin. Yes, correct. It's a clean margin. So basically our aim is to remove the tumor and make sure everything is clean. Yes. And of course, lastly, if it's inoperable tumor, most of the time it is more of a systemic treatment, which means immuno or chemotherapy. And sometimes, of course, there are other cases when patients have inoperable tumor that may require surgery. Example, some blockage to the bile duct or blockage to the stomach that patients cannot eat. We may do what we call palliative bypass surgery.
I see. So it's to sustain the life of the patient.
Correct, and improve their symptoms as well.
Okay, but I understand that if you do biopsy, it's actually to know what is the cell of the cancer, right?
Yes.
So in pancreatic cancer, you mentioned that sometimes biopsy is not necessary.
Yes.
Yeah. So how do then you determine the type of cell of the cancer?
Okay. So the most important thing is the size and the character of the tumor on imaging. Like I mentioned, CT and MRI is fairly accurate in diagnosing tumor or cancer. In any patients with a tumor of more than 3 cm, whether it's a cyst or a solid mass, in fact solid mass is more so likely to be cancer. In those patients, biopsy is optional. Of course, if patient is really keen to know that this is actually cancer first before any intervention, then we will refer to accordingly to get the biopsy to prove the cancer. But it is not a must before surgery. Yes, unless the patient has borderline resectable or inoperable tumor, then in those patients we will need biopsy because the medical oncologist will need detail about the particular tumor before providing any treatment.
So does PET scan necessary for?
PET scan is
cancer?
not the scan for diagnosis. It is a scan for staging.
staging, yes.
Correct. So PET scan is helpful because it will tell us whether the tumor has spread elsewhere or not.
Okay, so whether it's still operable or
yes,
not.
correct. Alternatively, instead of PET scan, sometimes we also do CT, thorax, abdomen and pelvis because it's a cheaper alternative compared to PET scan.
So usually if it's a pancreatic cancer, which organ does it spread to first?
Okay, the most common organ that you spread to will be the liver. Firstly, the liver, because the blood supply to the gut and the pancreas actually flows into the liver.
Flows into the
Yes,
liver.
correct. The second thing will be, second organ that is most commonly involved will be the lung. Okay. Of course, the other possibility is it can always spread to the lymph nodes around the pancreas.
Which can go everywhere in the body.
Correct.
Oh, okay. So when patient is diagnosed with pancreatic cancer, how does it affect his own life? I mean, like, is it very painful? You can't eat. How's the effect that the patient will feel?
Okay, that really depends on the location of the tumor. If the tumor is pressing on the stomach or the outflow of the stomach, patient may get what we call gastric outlet obstruction, which means patients will feel very distended. When they eat, they will vomit. And in this type of patients, usually they will lose weight quite rapidly because of poor nutrition. These are the patients that I mentioned earlier that may require bypass surgery to help them to relieve the symptom and allow them to eat. The second thing is, if it's pressing in the bile duct, patient may turn jaundice. And our worry is sometimes if they turn jaundice, they may get infection of the bile duct, which is what we call cholangitis. And that in patients who are frail can be life-threatening. Yeah, and pain happens usually when there is invasion, and typically pancreas may invade the nerves around it or the nerves to the back. So patient will complain of pain in the abdomen and also severe back pain. In this type of patients, usually what we do is we will try to optimize their painkiller. Sometimes if we find it to be a bit more complicated, we may get either palliative physician or pain physician to help us to try to optimize the painkiller. And in certain conditions, we may even get them to undergo procedures such as a celiac axis block, which is injection around nerves area to reduce the pain. Yeah. So it really depends on the location of the tumor and what are the things that it affects. You see. Yeah. So surgery for this type of patients are mainly to relieve symptoms and to allow them to have a more normal life. You see.
Okay. So is there any lifestyle changes that we can do to prevent us from getting a pancreatic cancer?
That's a very good question. So I will always tell patients that avoid things that are possible risks, such as smoking, drinking, alcohol, take a healthy, balanced diet, exercise frequently. Yeah, so these are the things that I think most doctors will tell patients.
So how can we help our loved one when they are diagnosed with pancreatic cancer?
There are a few components to that. Firstly, I think emotional support is very important. So emotional support means that we have to speak to the patient, see what are their needs, be with them, provide support when they have. It's a way for them to tell you what they want and also to ventilate if they need to. Secondly, ensure they have a good, healthy, as in good nutrition. I would say balanced diet with a good amount of protein as well. Make sure they're well hydrated. Number 3, make sure the patients can rest well. And number 4, very importantly, stay active. Despite having illness, try to ensure the patient can stay active by doing simple exercises, go for walks, go and do qigong, tai chi.
How does that help with
That will improve the patient's mood. Yeah.
I
So when
see.
the patient is more active, it will improve their mood. It will also make patient more compliant to treatment. Yeah. So all this add up together will help the patient.
Okay. So keeping active lifestyle and good nutrition, is very helpful.
Adequate rest, and
Yeah.
emotional support, I must say.
Okay. Thank you so much for your time and information, Dr.
You're
Lee.
welcome.